Hi, good morning, Billy. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 3rd of April 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Billy Paulson.
And what is your candidate number, please?
My candidate number is 212766181.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you find rewarding about being a nurse?
As a nurse, I support people during the toughest periods of their life. For me, being able to give patients peace of mind and hope when things are hard is endlessly rewarding. Helping to calm people's fears and giving them the information they need is always a pleasure. I realize that it is equally difficult for a patient's family members, so I also dedicate time to giving them the advice and support they need. I can't imagine a more rewarding and fulfilling role. It is a career that keeps giving.
What are your strengths?
One of the biggest lessons I've learned working in a busy ER unit is the importance of communication. The moment new patients come in, we need to assess their priority levels and needs quickly. There's not a moment to spare. I pride myself on my ability to effectively communicate well with doctors, nurses, and other medical staff. The first priority is always delivering the most appropriate care to each patient. I've learned that it takes a level of flexibility. By working alongside doctors and listening to their expert advice, I am able to offer the highest level of care and help to each one.
What's the hardest thing about being a nurse?
To be honest, I believe that the emotional strain is the hardest part of nursing. When you're dealing with patients and their families, it can be tough. You often have to deliver difficult news or support people in their darkest hours. I've found that the more mentally healthy I am, the better I can cope with these situations. For that reason, I focus on establishing a solid work-life balance and taking time out to rest when I need it.
What makes you a good nurse?
Being teachable makes me a good nurse. When I interact with patients, I learn to be more patient and understanding every day. During lunch breaks, I find it so fascinating to learn about new innovations in nursing from my more experienced colleagues. My openness to experience has always given me an edge in patient care. I can handle difficult situations with ease and will always put the comfort of patients before anything else. I've always been a naturally caring person.
How do you deal with workplace stress?
Having worked as a nurse for 5 years, I'm no stranger to the demands of the job. Finding a work-life balance has always been important in managing my emotional health. To switch off after a challenging shift, I find mindfulness meditation to be helpful. I actually use an app to meditate daily and get some grounding. In my free time, I enjoy swimming and exercising, which I find helps me to balance my stress levels. During my nursing studies, I attended a seminar on stress management and the importance of self-regulation. The speaker gave advice on how to leave work at work and how to use your social support system. I've taken these vital lessons into my career.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up.
Good morning, Mihiraa. I am your attending nurse, Billy Paulson. Can you please confirm the reason for your appointment?
Good morning, Billy. I have type 1 diabetes, and my doctor has recommended the pneumonia vaccination. That's why I booked the appointment.
All right. And Mihiraa, do you have any concerns to be clarified?
Even though my doctor recommended pneumonia vaccination, I have been thinking about it all the way to the clinic, and now I don't know if I really want to have it.
I acknowledge your concern, Mihiraa. I can explain to you why your doctor recommended pneumonia vaccination.
Yes, I would like to know about it.
For your understanding, pneumonia vaccination is also known as the pneumococcal vaccine, which gives protection against a range of infections caused by a pneumococcal bacteria. Well, Mihiraa, do you have any specific reasons for your reluctance to take the vaccination?
Actually, nurse, I have already received the annual flu jab, and it is enough. After the flu vaccination, I was ill. That's why I don't need any more vaccinations.
I am sorry to hear that, Mihiraa. By the way, may I know about your after effects of flu vaccination in detail?
Sure, I felt very feverish for several days and felt so tired. Moreover, my arm was also so sore that I wasn't even able to move my arm after the flu vaccination. I do not want to be sick anymore.
Okay, I really understand how you go through the situation. And what about your appetite?
It was okay. Beyond those symptoms, I didn't experience any.
Mihiraa, as you had after effects from flu vaccination, you can expect the possibilities of after effects for pneumococcal vaccination as well. Nothing to be overly concerned about. For your clarification, let me tell you what you can expect if you do take the vaccine and if you do not have the vaccination.
Yes, nurse, I wish to know about it.
Mihiraa, firstly, if you take the vaccine, you may encounter some side effects that are similar to that of flu vaccination, which will be generally mild and short-term. These side effects will be relieved with paracetamol, as well as with increased fluid intake.
Okay, and now, what if I don't take the vaccine?
Perhaps, if you do not comply with vaccination, you are at high risk of contracting a pneumococcal infection, which can have severe consequences on you, like pneumonia, septicemia, meningitis, etc., which, in the worst scenario, can even be fatal.
Yes, nurse. I understand that. But I don't wish to take the vaccination. That is because I am less likely to get pneumonia than the flu.
Your thoughts are quite reasonable. However, it is important for you to know about the vulnerability of pneumonia to your health.
I would like to hear about that.
Mihiraa, your age is the first factor. As you are 65 years old, your body will be weak normally. Secondly, as you have type 1 diabetes, it affects your immune system. Long-standing diabetes weakens your immune system and increases your predisposition to diseases and infections. I hope you understand the risk involved.
All right. I have to consider those factors as well. Isn't it?
Absolutely, Mihiraa. You have to consider these factors as well.
Okay, nurse, I understand the need for the vaccination a little more now.
Good to hear from you, Mihiraa. So, now, are you willing to take the vaccination?
Yes, nurse. I will go ahead and have the vaccination.
Glad to hear that, Mihiraa. I can reassure you that it is completely safe to have the pneumococcal vaccination.
All right.
Thank you for your understanding. Can I get your consent for the pneumococcal vaccination?
Sure, nurse. You may please proceed with the vaccination.
Thank you for your consent, Mihiraa. I really appreciate your decision.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.